All right, so one of the really questions we get all the time is kind of why Alabama, and I think we were both a little bit hesitant when we first came here about living here, but we have found it's been a great experience. Joe, I'll let you touch on it since you're the most recent.
Yeah, we moved here from Georgia. Actually, I was staff at Augusta University and on Fort Gordon, and Sami called me, and he called me up. He said, "Hey, we're in got this practice. It's in Montgomery, Alabama. Don't hang up. It's a great place." So my wife came down, checked it out. It's a beautiful area. The people are friendly. There's a lot of good food. There's a good culture here. And it's a really nice, warm community that really welcomed us, and we felt at home here ever since we moved.
Yeah, and same with me and my wife, Lily, who's our PA as well, who you probably will meet if you come to our practice. But one of the cool things that we've been able to do here is really build a beautiful facility. We have an accredited surgery center here. We also have access to the hospital should we need it for any reason. Joe does do some of his cases in the hospital. I typically do most of ours in the practice here. And as far as staying afterwards, we both have a membership at our local country club. There are some condos there that are available to be rented out. People do find that to be a really nice place to stay. It's just a nice environment. Some people will choose to stay in an Airbnb as well. There's a beautiful lake right near here that you can stay on for recovery. So just a lot of nice things I think we can offer here at less of a price really than if you were in like a Beverly Hills or something like that, but still getting the same quality.
Well, Sami, one of the things that impressed me the most when I came to interview here was your beautiful facilities. So could you please talk to us a little bit about the surgery center?
Yeah, sure. So just like you said, this is a surgery center. So from the second you walk in, we have a beautiful lobby. There's even a water feature I insisted we had. We have a nice elevator that'll take you up to the med spa area of our facility. Usually we'll get photographs of you just so we have something as a baseline and something to really treatment plan from. We have a 3D camera system to help with simulations to see, like let's say we're moving a chin forward or something like that, really to see what it would look like so you can see what it looks like, or even a rhinoplasty or something just to kind of make sure that we're on the same page with treatment planning. We have a beautiful consultation room. We have a little snack area as well, just in case you're hungry while you're waiting. Obviously can't do that when you're having surgery. As far as our surgical facilities, we have a private holding area / recovery room, so that way you and your loved one or whoever's with you for surgery can have your own privacy. We're sitting in our OR right now, which is really up to the same standard of any OR in the United States of America. That is because we are Quad A accredited, which is an outpatient accrediting body basically that makes sure we are to those standards. So really just a top-notch facility here, and God forbid we ever need to go to the hospital for anything, or that case is more complex, especially for some of Joe's stuff sometimes, he has the ability kind of to go to the hospital and do things of that nature.
One of the things to stress too is that we offer the full range of anesthesia services. So both Dr. Nizam and myself are board certified dental anesthetists. We both can put people to sleep, but we also have an actual functioning operating room, to stress that again. So if you need to be put completely to sleep under general anesthesia, we have that capability here. We have CRNAs that come here and do our anesthesia for us. And as he said, for those patients that are more medically complex or have more complex surgeries, we can take you to the hospital, which is right down the road, to do your surgery. So we offer absolutely everything that you'll need to get the results that you want.
Well said. So Joe, one of the things that drew me to you and that I thought is pretty awesome, to be quite honest with you, is your military background. It just automatically told me that you're a good guy. So why don't you enlighten us on that?
Absolutely. So I actually spent 27 years in the United States Army. I started off as an infantryman, got out, went to school, came back in as a dentist. It was while I was actually deployed to Afghanistan with special operations. I'm part of a medical detachment. I was doing a lot of trauma, and that's where I fell in love with oral maxillofacial surgery. And I spent the next several years going to residency and then fellowship, and I spent the last decade training residents in several different residency training programs, both civilian and military. And all those experiences kind of built up to my personal philosophy of surgery, which is to always stay on top of what's cutting edge and what's new in order to offer to the patients the most modern techniques available while still respecting patient autonomy. And so I see my job as a surgeon is to educate you, get your goals, educate you on what I can offer, and then allow you to choose your own path so that you actually are taking ownership of your own treatment.
Yeah, awesome. My philosophy is pretty similar to yours. One of the things that's really important to me is staying up to date. So techniques have changed even throughout my training a tremendous amount, and I think for you the same. But there's also, hey, is newer always better? No. So to balance having experience, knowing really what's going to be the best for the patient. So I like to get to know the patient as much in the beginning, just so I can kind of root out, well, really, what is your interest? What are we trying to get at? Am I going to be able to achieve those results for you? And I think that's a really big one sometimes, because you don't want to go to a surgeon and them not really understand what you're looking for. And like I said, we have many techniques to try to kind of whittle away at what it is you're looking for, and then to find out if that's really actually going to be achievable for you to do. And then kind of once I have a good feeling and we have a good rapport going, and honestly, I will tell you, not everyone has a good rapport with their surgeon. You really should go to the person you feel the most comfortable with, because not all surgery is perfect, and you want to know that somebody's going to be there for you if there's something you're unhappy with, or something maybe that even goes wrong potentially, which is rare, but it does happen. And having somebody really by your side that you feel like is a family member there to help you and be your advocate is super helpful, I think. And I think you share that same thing, and I think that's why we get along so well, because I think we both feel like we both treat patients in that same similar way. So yeah, very similar philosophies. I think that's why we work so well together.
All right, so you've talked about practice, we've talked about our specialties, we've talked about things that we like to do, but Sami, why don't you tell us a little bit about what you like to do outside the office?
Yeah, so I do things outside the office, although sometimes a lot of my staff calls me kind of a loser, because I spend most of my time here focusing on surgery, learning about surgery, preparing for cases. In my free time, though, I love working out, staying fit. That's like a huge thing to me. It has been my whole life. I used to do a lot of Olympic weightlifting in high school. I've been active in sports really my whole life. I do like sports now. I probably do a little less just because I don't have a ton of time. I actually started playing pickleball the other recently, which has been kind of fun. I love spending time with my family. My beautiful wife, who actually works with me, she's our physician assistant at the practice as well. And we have two little chihuahuas that I never thought I would get chihuahuas, but I actually love them to death. I'm sad to admit that on camera. And I like volunteering and doing things that are good for the community, and just things of that nature. Joe, I know yours is going to be pretty similar, but tell us a little bit about it.
Well, outside of work, which is not a whole lot of time, but plenty of time to pursue some hobbies. I really enjoy cooking. I love lifting weights, exercising. I really like to read. We spend a lot of time researching different things because we've got a property outside of town of going to build up a little homestead farm kind of thing out there. I also like volunteering with my church and spending time with the folks down at our church, and more than everything else, I really love spending time with my wife and my kids and just hanging out with them, even if we're just watching TV or going out and playing sports, or just to take them out exploring across the state. Those are the kind of things that I like to do outside the office.
And we do have a great state for exploring.
Yes, we do.
If you're interested, certainly go to our website, check out. We have a lot of information on there about both of us. You can set up a virtual consultation. We can tell you what our thoughts are virtually. If you have a CT scan, we can take a look at it. He can work with really an orthodontist from a distance if need be. We really can just make it a good experience for you and really give you everything we have to offer.
Absolutely. So we look forward to hearing from you.